Welcome to Now Innovating, a Research to Impact series at the University of Calgary. I'm your host, Julia McGregor. For our Season 6 premiere, we are exploring the Family First Responder project. Family First Responder is building mental health programming for fire, paramedics, police members, and their families. I speak with Dr. Kelly Schwartz, a registered psychologist and an associate professor in the Werklund School of Education. He's the director of the social development research team that aims to improve the well-being of individuals from across the lifespan by removing barriers and identifying strengths and protective factors. Hi, Kelly, and welcome to Now Innovating.
So good to be here.
I'm really happy to have you, and thanks for joining us at our season premiere.
Yeah.
We've really great opportunity, to film today at Station 16 of the Calgary Fire Department, which is so related to the project we're going to be talking about today.
Right.
But first, I'd really want to give our audience a chance to learn more about the general research you do at the Werklund School of Education in the School and Applied Child Psychology program.
Right. Well, I don't know how far you want me to go back, but I started with the university in 2007, and that was after kind of a career as a school psychologist, and I also taught at another institution. But when I came to the university, I directed an on-campus clinic for 7 years where we worked with children and youth with all sorts of mental health, behavioral, school issues. It was no surprise to me that as we were working with those kids, that we were also working heavily with their families. And so I wasn't doing a lot of research then because I was mostly doing clinical supervision. 2015, I changed roles and moved into a regular faculty position and just carried over my thinking and the practice of just thinking more holistically about children, youth, and families and how it's a system. And at that time, I was taking on more graduate students, and we started what became known as the Social Development Research Team, or what we call SDRT. So we were doing research in all sorts of areas, looking at screen time and children's behavior, looking at parenting practices. We had some great work that we were doing with some First Nations communities and schools outside the area. We were doing stuff with hockey programs, looking at the impact of that on child and youth development. So it really truly was this full expanse of kind of social development and what that means for kids, and particularly what it means for families. So we started that in SDRT in 2013, and we've just been doing research in all areas related to social development as it happens.
Engine 302, Ladder 6, Rescue 23, High-Rise 2, Map 14, Charlie 1.
Well, that was exciting.
That was great.
Yeah,
good timing.
Active call happened here. Active fire stations.
That's what we want.
So our backdrops change, but that's we're working in a place here that is responding to calls.
That's exactly right.
So as you said, before, your research is all about child, adolescent, and family well-being, and that's so what led to the start of Family First Responder?
I got invited to a fundraising banquet for an organization, and this was in, again, 2013, 2014, and it was for military, and got talking to them and asking, well, what is there for families and children and youth? And they're like, not a lot. There's so much has been done for mental health stigma awareness, mental health supports. Even though we're still talking 10 years ago, it was still building, but nothing for families. So I don't know, a light just went on in my brain going, wonder how we could start to do work in this area. So I actually got involved with a couple of projects, a couple through Veterans Affairs Canada, where we actually interviewed families of military and veterans who were moving from military to civilian transition. Did some interviews with them, really got a sense of, wow, these families are experiencing a lot of what's going on with their military member. Then we started to think about, well, if it is happening in military, where else is this happening? Then we started to have contacts. In fact, you're going to hopefully talk with a colleague of mine here from Calgary Fire about the impact of operational stress on not only the members of the service units like police, fire, and paramedics, but also the family members. So this is what spawned this whole thing, was just stumbling into this through my work with military and then transferring over that knowledge, or rather the gaps in knowledge, and then starting to investigate that within first responders and their families.
So my name's Scott Cowan. I'm the battalion chief with the Calgary Fire Department for Delta Platoon. and I work here at Fire Headquarters and manage all of the firefighters that work across the city. So I've been involved with Dr. Kelly Schwartz for many years. About a decade ago, I did my master's degree, and during that I did a thesis on building resilience to critical incident stress for firefighters. And it was through some of that research that conversation started with Kelly about the programs that he was starting and the research that he was doing, and we've kind of been involved ever since. We're seeing more and more resources coming to the first responders themselves, but that's only part of the puzzle. It's really valuable to have the home side being looked after as well. People are holistic and they need to be healthy at work, they need to be healthy at home, and one way that people can be healthy at home is when family members understand some of the things that they're going through and understand mental health in the same way that the first responder does. It's really valuable to see everybody on the same page and having that teamwork kind of at home as well as at work, and that Family First Responder program really allows for that, bringing that education so that people are on the same page. What the first responders are learning is the same thing that the families are learning. There's just value in seeing the families being taken care of and learning the same things and being able to address mental health issues and resilience from that side of things. So I think there's great value in what that program brings to our first responders.
So can you tell us more then about the actual study and methodology behind Family First Responder and really how the Rebuilding Families program is offered?
Okay. We submitted a letter of intent in late 2019 because there was a call for research from Canadian Institutes of Health Research, CIHR. And they were looking to fund projects that was going to impact mental health of public safety personnel, of which first responders are a big part of that. So we put in our letter of intent, were chosen as a finalist, then submitted a full application, were accepted, got our letter of acceptance on March the 30th of 2020.
Oh, of course.
Which was right when the world changed. So we immediately hit the ground crawling, I call it, because we were all just, well, we're not gonna, and again, as you remember, first responders, frontline medical staff, they took on so much during that time. So we just devoted the first 6 months to, again, literature reviews. We designed focus groups that we then ran in the fall of 2020. So we gathered with spouses and partners and first responders, talked to them about the needs of the family. So we gathered that information. That then informed a cross-Canada national survey that we did with both family members and first responders in early 2021. We then developed the program over the next 6 months, and then basically we started to pilot the program in early 2022. And that was, by piloting, I mean we developed at that time, a 5-week psychoeducation and support program that we offered virtually, because of course we were all pretty adept with that. So we did. Interestingly enough, in our original application, it was all supposed to be like this, in person, sitting in a room with 6 or 8 other spouses, a mental health facilitator. We transitioned to do this online, which in hindsight actually worked out better because we were able to now offer this program literally to anybody wherever they were because they could join. And I should say too, one of the things that we did was when we were thinking about our program and what to call it, we really came to understand that we wanted families first in whatever we were doing. So kind of kitschy, but we family first responder. So it says in everything we're doing, we want to put families first when we think about first responders. And that's a very unique perspective on this. So yeah, we developed the program, piloted it, and then we called that family Rebuilding Families. So the program that we're offering is called Rebuilding Families. Again, I don't know, it's probably because I spent too much time in studying English language and Latin, but the word re just means all about or pertaining to. So our program is all about building families. So it's not that first responder families need to be rebuilt, but we're all about building those families. So that's what essentially led to what we now have as our 6-week Rebuilding Families program. We offer it online, virtually facilitated, and then we also offer a self-directed program that you can just go through at your own pace. So 2 versions of the same program.
I know when we visited your lab, there was like smart. You had the Garmin watches.
Oh
Was there a component? Yeah, you got one.
We
on
get these
too.
in. Yep.
So is that part of the study too?
A big part of our successful application was Because I've been doing work with questionnaires and survey data for decades.
Yeah.
I mean, it's good data. You're getting firsthand responses, rating scales, that sort of thing. But we also knew, and again, this probably came from my conversations with first responders going, they don't have time to fill out questionnaires. They don't have time to do all this. So we were thinking about different ways of measuring data or gathering data. So we partnered with Garmin Canada and a couple of other companies. And so all of the participants in our study, both the spouses and partners and the first responders, because even though the first responders aren't part of our program, they're all wearing Garmin watches throughout during the 6-week program and then for 12 weeks afterwards. We have a really light hypothesis, and I can't emphasize light enough, that maybe through our program, it actually might change sleep habits, might change activity levels. Garmin has a stress variable that they're measuring, so we're wondering, does we actually see changes in stress? So we're really excited to analyze that data just to see if nothing else, this is just a great new way to measure and gather data.
Yeah. And
then secondly, to see if programs like ours actually leads to changes in any parts of this functioning.
I love this. Like you got the survey, the qualitative data. Now you've got actually like some health data informing it too. This is really cool.
It's very cool.
So I know you've talked kind of about a little bit about how great this could be, but and I know you're coming to the end of this 5-year study and you're analyzing all of your data you've got going on, but what are you seeing are some of the potential impacts of this like social innovation for first responders and their families?
We've just got pages of qualitative data that is saying it's so good to finally be seen as a first responder family. And we learned really quickly too that even though our project is about working towards making the first responder more healthy and sustain them within their work, that it's also just about meeting the needs of these family members and recognizing them as individuals. And so the family members really appreciated just being identified and noticed and having a program that was specifically designed for them, because there's nothing else out there like it. And then we hope, and you and I've talked about this before, a colleague of mine has a program called Before Operational Stress, or BOSS. So the ideal situation would be first responder would take the BOSS program, spouse or partner would take the Rebuilding Families program, and now they've got a common language to talk about mental health, to talk about operational stress, to talk about communication, relationships, all those sorts of things that maybe they didn't have before. Now they've got a common language to actually start the discussions. Maybe they do find more individual supports and helps afterwards. So we're very clear that our program is not necessarily an intervention program, psychoeducation and support. And I guess that would be the second takeaway is, especially for the spouses who were in the Zoom rooms with 6 or 8 other spouses, I mean, you could just see it on their faces. They were so happy to be in a room where they could talk freely about their experiences. And I want to emphasize too, not all negative. Like, these are incredibly strong families already. So we were unearthing and applauding them for the strengths that they were experiencing. But then also when they started to talk about the needs and some of the unique, risks that they were experiencing, they were just so encouraged by that, to be in a room with other spouses, that they could have that kind of peer support as well.
Like, were you separating the types of first responder families? Because obviously family members of police versus fire versus EMS would have like different experiences.
So we do think there might be some subtle differences showing up amongst the family members that could lead down the road to us to say, actually, we need to design, a specific Rebuilding Families program for fire families, because this is what they told us was unique to what their experiences was compared to police and paramedic.
Awesome. Yeah. So I guess that kind of leads into like my next question too, because you're analyzing all the data from this piece. You've got the program built. It's Canadian focused. So what are the really opportunities to scale it forward, and maybe building it based on type of family?
Yes.
Yeah. So what are the opportunities?
So here's where I move from the area of real comfort, which is research and clinical, and now into the marketing promotions
Yep.
piece, which I'm absolutely, so that's been so great to work with Innovate Calgary on some of the, some of their expertise there, getting direction on how do we take our intellectual property, move that into, a scalable product.
Yep.
So we're just in the midst of, in fact, we've just incorporated Family First Responder Inc. That we're going to be now using that as the house to then develop and deliver this scalable product. So in fact, this fall, I'm going to all sorts of conferences where we're actually talking about this to say, if this was offered to you, how can we make this available to you and accessible? Those are two different things.
Yeah.
Because service groups are always, they're under a budget, they don't have a lot of money for this, but how can we make this readily available for family members in a way that, again, shows that we're supporting the whole system of the first responder, not just necessarily the individual.
Yeah, the innovation journey, no matter what, is always very complicated, and that's why there are these resources and supports available, like Innovate Calgary.
For sure.
Have. So I know, as you said, like you're kind of like newer on the social innovation path, but like, what advice would you have for other researchers who are looking really to translate their research into a solution for community?
Yeah, I mean, when I look back over the 5+ years that we've been working on this project, for me, the key that kept moving us forward was always keeping the end goal in mind, which was how can we provide a meaningful, difference-making service to family members of first responders. Because there were many times along the way where you're up against all sorts of, well, again, because we were working within the pandemic too, so that first 2 years was really difficult to engage because, again, first responders were so stretched with what they were being tasked with in regards to the response to that. So my advice is, my team, and I want to emphasize too, this was, I had a team of 12, 14, 15 people all the time. So that is so important, is to keep the team focused on the end product, which for our case was, how are we always thinking about, is this making a difference to families of first responders, and how do we make this then accessible to them once we're done our project?
And I think too, what's so key of this project and all these, and it's good advice for all researchers, is really engaging those community members throughout the process of the research, and making sure it's tailored, and what you've done with rebuilding families, what you've done with Family First Responder,
totally,
it's perfect example.
And I think I mentioned to you earlier how we spent so much time, valuable time, meeting with the first responder community, like going for coffee. We did pizza nights with families where we just get around and talk about, like, what's it like to be a first responder family. So that part was always guiding and directing our work, because we didn't want to lose the focus that we knew best, because we didn't. We knew about the research side best and about how to develop and deliver a program, but we wanted to always stay on track with what the families were saying to us too.
Kelly, thank you so much for joining me and sharing more about this amazing project.
Thanks for inviting me. I'm so excited to be part of the first episode of your season. It's great.
You can find links in our episode description to learn more about the Family First Responder Project, the Before Operational Stress Program, as well as the Social Development Research Team. And of course, to find out how to move your research to impact in the UCalgary innovation ecosystem, visit ucalgary.ca/innovation.